Thank you, Mr. Chairman. Thank you, Senator Murkowski, for talking about the DHAT program in Alaska and a lot of the successes of it. I'd like to ask Dr. Taryn, in your career as a dentist, and I knew you were a pediatric dentist, I just said pediatrician. Have you seen a dental therapist give substandard care?
I have not. I was in England last year and visited 2 training programs and was continue to be very impressed by the level of education that is received, the competence, the commitment, the dedication among the students who are learning dental therapy, and then going out into the community to a practice situation, a community clinic, and again, seeing the high level of professionalism and the fact that their patients really appreciate the standard of care that they're getting, to the point where a dental therapist who recognizes that a procedure would be beyond her scope of capability and wants to refer that patient to the supervising dentist, the patient's a little disappointed and would rather have the dental therapist provide the care.
And I think that I would argue that substandard care, the most substandard care, is offering no care at all. Would you agree with that?
Completely.
Now, have you worked on Red Lake Reservation?
Unfortunately, no.
Do you know anyone who has?
I know the dental hygienist that works there, and I know that they're desperately short of access for dental care. For example, they send patients down to the Twin Cities, children who need care who have extensive dental needs and would most benefit from care under general anesthesia. And that's 250 miles. It's a long way to bring a small child.
Ms. Dodemain, do you see any reason why other locations that are suffering from a lack of dental care shouldn't use the mid-level dental provider model that's similar that you use in Alaska?
No.
Okay.
None at all.
Dr. Tankersley, shouldn't everyone have access to dental care?
We believe they should.
Okay. In your testimony, you said something interesting. You said this year alone, there will be 70 additional dentists providing care in tribal areas. That was your recruitment. And then you went on to say, with one more year of similar recruiting success, the shortage of dentists in the IHS could be eliminated.
Yes.
Do you know how many dentists there are in the IHS?
I don't know the total, but I think the number that the IHS wants is low, as it is in some military situations.
I'm sorry, I didn't understand.
I don't know the total of dentists in the IHS. No, I don't.
Well, the numbers don't seem to make any sense to me. Do you know what the shortage
Well,
is?
the IHS has a quota, just like military does, for how many posts they have. And for years, there's been an inability to recruit dentists to the IHS. And in the last short period of time, we've been much more successful because of some of these programs that we have instituted in getting dentists to the
Okay, well, if you don't know how many dentists there are in the IHS, and you said that recruiting 70 more could eliminate the shortage, I don't know how you can make that statement.
Because there are
600 dentists in the IHS. Do you know how much of a shortfall there is?
Yeah,
How much
shortfall at this point is about another 70 dentists, and they have
No,
abilities.
it is not. The shortfall that I have seen is about 25%. And do you know what the turnover rate is?
I don't know the statistics, but the turnover rate is high.
So when you said that with one more year of similar recruiting success, the shortage of dentists in the IHS could be eliminated, why did you use the word could?
Because there's no way we know that it will be eliminated.
Why did you even bother to say it? Because
Well,
the turnover rate
because-
is about 30%, sir.
Yeah, but because there is for the first time in many years, there's a positive trend to actually get dentists into to the Indian Health Service.
Well, your positive trend was 70, which to my calculation is it's like 11, 12%. And if we have a 24% shortfall and we have a 30% turnover, I don't see how 70 new recruits can possibly eliminate the shortage. And so it just bothers me that, I mean, I think we agree that people need dental care.
We do.
And I understand that the ADA represents dentists and you want people who you represent to do this work, and I applaud dentists who do this. But we have a model here that seems to be working. And we have a shortfall in Indian country. And it could do a lot of people a lot of good. And I wouldn't mind if you could meet that shortfall. I would love it. But it doesn't seem to me that from your testimony that you are that your testimony is convincing at all. And what I want to do is make sure that kids in Indian country don't have rotting teeth. That's my responsibility. Thank you. Thank you, Mr. Chairman.